One very typical problem as a pediatric gastroenterologist and hepatologist that we face is the moment you tell that your child needs or may need endoscopy, then parents get very scared. It's right only. I will not say that their worry is wrong because endoscopy is an invasive thing, but we need to know few things that I will tell that what exactly happens in endoscopy, but it is not something that we do usually in all the kids who come to us. Like as a gastro person, I has to do endoscopy. It is not like that. First we have to see what is the problem of the child. Are there other alternatives other than endoscopy, that by trying some medication, or it is looking something very common or normal thing like normally we do in reflux problems, gastroesophageal reflux disease in older kids, or acute gastritis kind of thing which is prolonged. So many of the times medicines take care and we avoid doing endoscopy. So those are the situations where we don't need to do endoscopy. But there are situations where endoscopy becomes very important, like a child is having chronic vomiting, not getting better with the medications. We are suspecting a liver disease, that where endoscopy can help. Definitely, if child has swallowed something, foreign body swallow, then endoscopy is a mandatory thing. If we are feeling some esophageal disease narrowing, like our food pipe problems, stomach related problems, or many of the times in chronic diarrhea children, we feel that we have to take biopsies from the small intestine. If the child is having blood in the vomiting or blood in the motion, then endoscopy becomes very important. Many of the times when children are having chronic pain abdomen and not getting better, we are ending up blind, ending up without any diagnosis, then many of the times we discuss that maybe your child needs an endoscopy. So what we need to know about endoscopy is many of the times kids, because endoscopy is, I will not say a very painful process, but it is a bit scary, I will say. If you don't give anesthesia, if as an adult you have undergone or you have seen, so a tube has to go inside the mouth and look everywhere inside your food pipe, stomach and part of small intestine. Kids many of the times get scared with that, and what I will suggest that many of the times we give the parents an option, and preferably we say that we should give mild anesthesia so that child is comfortable during the procedure. There is no pain, there is no negative memories associated with the doctor and the procedure and everything, so that you can do a good proper endoscopy rather than in a hurry, that when child is crying and you are trying to do it. That is all never a very pleasant thing to do with a kid or with anyone, I will say. So normally we prefer that child should get some mild anesthesia. He is comfortable sleeping, the process is done, and then they even don't know. The process usually may take from 5 minutes to 20 minutes anywhere, depending upon what is doing inside the with the endoscope inside. So most of the times after the procedure is over, anesthesia may wean off immediately or within 1 to 2 hours, and the children may feel normal after that. Sometimes they say that I'm feeling something in the throat because endoscope went, but that all some medicines are by itself. So normally endoscopy is a very safe procedure, painless, I say, with the help of some anesthesia, and the children may not even know that what was done, and also we don't need to scare them that something is going to happen with them. And it can give us very useful information about the disease, maybe something we are treating which is not there inside, so we can avoid a very long treatment. Sometimes we are missing some very simple disease which we can diagnose, like many of the time allergy related esophagus problems or food pipe problem, or when it is mandatory, then it has to be done like foreign body removal, or child is having blood in the vomiting. But you have to have an expert person who is doing it, who is well versed in doing pediatric endoscopies, like we do from starting from 1 kg baby till, I will say, 80 kg. Some of our 18-year-old kids are like that. So we should know the age specific requirement, age specific endoscope sizes, and a good pediatric anesthetic team and PICU team, that in very rare chances if anything goes wrong, that can be taken care of. But in our experience, like we have done here more than 1,000 endoscopies, we have never faced a major problem. So these are the things which parents must know, that you have faith on your doctor, you know why it is being done, what can be the implications of the result of the endoscopy, and are there any problems going to happen after that. So overall, parents don't need to be scared too much about it, but have the information, understand everything from your doctor, and then you can go ahead with that.